Hi, my name is Amanda Hum, and this is Veterinary 122 Radiography. The avian species is what we are taking radiographs of today. So to start off with radiographing, we measure a bird. You're not actually going to measure the bird itself. There are actually set settings on your machine, and ours is digital, so ours automatically, you put in the species and it'll automatically set it for you. However, there are larger versus smaller birds, so you may have to adjust it so you can measure if need be. When you measure, be aware that birds have a lot thinner bones, tubular bones, more ossification within their bones, and they have less calcium. So it makes for more radiolucent x-rays. You do want to have a higher MAS, so the seconds will be shorter. The KVP should be lower. We do recommend a non-grid technique, and you do a top method, cassette on the x-ray machine. So you use a cassette and place the patient on top of plexiglass or something like that on top of the cassette. However, our clinic, like I said, is digital, so we do not have the option of using a cassette. So it's already set to tabletop method when we put the avian species in.
There are three separate types of techniques used for avian species in order to take x-rays. The three types of chemical, manual, and physical restraint. Chemical restraint, there are two more common ways to do the chemical restraint. It's either inhalant anesthetics like sevoflurane or isoflurane, or you can use an injectable anesthetic like ketamine. Ketamine is 20 to 50 milligrams per kilogram if you are going to give that. However, a big adverse effect to that is after the injection. It's a long recovery and it can be a difficult recovery time afterwards, so definitely be monitored. The second type is manual. Manual is physically a technician or assistant manually restraining the patient. This can cause scatter radiation on the patient as well as the person holding, so you do want to wear the proper equipment. You want to wear the lead apron, lead gloves, diver shield. This is again one of the riskier ways to take an x-ray. The third type is the physical, which is used with devices. So you can use plexiglass, like I said earlier. Plexiglass can be placed in between the cassette and the patient. If you do that, you need to add 2 to 4 increase on the KVP. You can also use sandbags, rope or tie gauze, sheet, and radiolucent tape. The problem with our clinic is we don't have radiolucent tape, and a big problem with tape is that it can pull feathers, it can pull skin off, so it can be very detrimental to the patient. So we try not to use anything other than the proper tape. For larger birds, we do not recommend fasting the patient. However, if you need to, no more than 4 hours. Birds need to eat very often, so we definitely have to make sure that they're being fed within a 4-hour period. There are 4 main things you can do for radiographing. One is a whole body ventrodorsal view. Another one is the whole body lateral. You have the caudocranial wing view, or you can do a GI contrast study. The whole body VD view, you place them on their back, wings open, body as straight as possible. You want the sternum to be on top of the spine. The second one is lateral view. We do try to have you placed in right lateral recumbency. You pull the wings back, and again, if you're using physical restraint, you tape them back. If you're using manuals, you would physically use a hand to place that behind, caudal to the body. The third option is the caudocranial wing view, which is very similar. You're going to kind of pull back and you want only the wings in view. Now when you do a whole body view, you can also get the wings in place. The contrast study is the gastrointestinal contrast study, and that is used to see if there's any blockages or anything like that. You can use barium, and there are other contrasts you can use. When you do the taping, the first things to be taped down should be the head and the torso. Second should be the wings, and third should be the legs. The problem is that if you tape down the wings first, they may try and pull their body off of the tape, which I have seen before, and they can kill themselves because they do stress themselves out while being on their back. We did use a live bird today in our x-ray video. However, the dove was not very cooperative, so I tried to demonstrate a manual view of a right lateral recumbency. However, again, the most effective is the chemical restraint, but if you cannot do chemical, manual is more than likely the least conducive for straining.
It is recommended to do anesthesia or some kind of light sedative, usually with a mask. This helps. So we would put that information into our x-ray machine. Again, the KVP will be a little lower, the MAS will be a little bit higher. So we would actually lay down. So she is breathing heavily. As soon as I let her go, she's probably going to try and fly away. But, yeah. So one way would be to laterally place her. And to, good girl, and to lift the wings up. Again, so if I pulled both wings up, later laterally, ideally pull her legs back. As you can see, she's going to try and fly away. You can also see her fly away. This is the radiograph of what a proper VD positioning view of an avian species would be.